Proposed Medicaid cuts could leave thousands of people in Dakota Territory without the care they need.
Our Zeta Jones joins us in studio with more on what this means for recipients.
A federal budget plan to cut $880 billion from Medicaid is raising alarm in South Dakota, where nearly 150,000 people rely on the program. Lawmakers say the cuts are meant to reduce federal spending and help pay for an extension of tax cuts set to expire this year. But Hansen says these cuts will be detrimental. The proposal could leave 8.6 million Americans uninsured. That's according to the Congressional Budget Office.
There is no way to cut out, wasteful side projects or, with Medicaid, there's no real side projects. It goes directly into insuring people to get things like checkups, to help people stay in nursing homes. You can't cut $880 billion from a program like this that's going directly to, in the case of South Dakota, 147,000 South Dakotans, and not expect it to rip away coverage for folks that this is how they've gotten theirs.
On Tuesday, House lawmakers will debate the cuts, and Hansen urges South Dakotans to contact Senators John Thune, Mike Rounds, and Representative Dusty Johnson to remind them how he says this will drastically impact rural hospitals, nursing homes, and patients in South Dakota.
So Zeta, what about the Medicaid expansion South Dakota just passed in 2022?
The cuts could make it harder for people to qualify or get covered, even though voters approved the expansion.
Will this affect healthcare workers here in the state?
Yes, if hospitals get less money from Medicaid, they might have to cut staff or reduce services, especially in smaller towns in Dakota Territory.
Thank you.